all to today's special seminar, which is specially focused on eye health and safety. This is organized for the Vigyanika Shakti children, but not only the children, but for all like who are now exposed, who are spending a lot of time in front of the electronic gadgets most of the time. Someone taking class, someone doing some work from home. So it's very much necessary and call of the time that we have with us Dr. Zia Chaudhuri, and who is a famous ophthalmologist. And her introduction, I would like to request our Secretary, Dr. Rita Bhattacharya, to introduce Dr. Chaudhuri.
Thank you. Welcome to all. Today we are very happy to have Dr. Zia Chaudhuri. She is a very famous, prominent eye specialist. So, and she is very much eager to meet our students. Those children are really our angels. Today, I don't know why very less attendance. So I'm very happy to have not only me, Kolkata Nivedita Shakti, as well as our Vigyanika Shakti is really very happy to have a person like Zia Chaudhuri. Let us clap for her. Everybody, unmute. Everybody, children, please unmute and welcome her. Thank you. Thank you so much. So let me introduce her. Zia Chaudhuri, MS, DNB, MNA, MS, FOCS from Glasgow, FICA, PhD, Genetics. FAMS is a Director Professor of Ophthalmology at Lady Hardinge Medical College and Associated Hospitals, University of Delhi. And Dr. RML Hospital and ABVIMS, New Delhi, India, with specialty training and work in strabismus, pediatric ophthalmology, neuro-ophthalmology, nystagmus, and genetics. She has over 150 publications and has edited 5 books in ophthalmology. Dr. Chaudhuri has extensive teaching experience of more than 24 years in guiding and mentoring undergraduate medical students, postgraduate students in ophthalmology, research fellows in biotechnology and genetics, nursing officers, technical staff, optometrists, as well as international mentees, both clinical and research, under the aegis of the Association of Research in Vision and Ophthalmology, ARVO in short. She has awarded the Boy Scout Fellowship of the Department of Science and Technology, Government of India, for undergoing training in dynamic functional high-resolution surface coil MRI of the eyes in strabismus and optic nerves at the University of California, Los Angeles, USA. She has also been awarded the ICO Fellowship for specific collated training in strabismus, Neuro-Ophthalmology and Nystagmus at the University of UK. She has been principal investigation of 3 scientific projects funded by Government of India, reviews scientific articles in high impact peer reviewed journal like IOVS, BJO, JAAPOS, and Ophthalmology, is an editor of peer reviewed indexed journals in ophthalmology, such as Strabismus and BMC Ophthalmology, has been an annual meeting program committee, AMPC, member and chair of the EY section. Eye movements, strabismus, amblyopia, neuro-ophthalmology of the Association of Research in Vision and Ophthalmology, ARVO in short. The largest global ophthalmic and visual science research organization. She was awarded a PhD in genetics from the University of Delhi for her doctoral work on the genesis of strabismus, making her one of the few clinical scientists in few clinician scientists in India performing both high-end clinical work, including surgical work, as well as practicing in laboratory work. High-resolution surface coil MRI in strabismus, as well as contemporary discovery, genomics approaches for identifying novel genes for strabismus comprise Dr. Chaudhuri's current research work. There are so many new words for me, and for children, you can understand with her this introduction. She is such a big person, and she learned a lot. She got so much degrees, isn't it? She is your not only eye opener, she is your role model, isn't it? Divyanshi, tell me.
Yes, ma'am.
Thank you. So, welcome, Zia Chaudhuri, madam. Please, now the platform is yours.
Thank you, ma'am. Because
I just wish to ask you, when you will start, my first question is, what is strabismus?
Yeah, that is what. I'll come to that. Okay. I'll first come to that because you see that repeating in whatever I say. Okay. Whatever I write about myself. Yeah, it identifies me, in fact, and the work that I do. And all that was words. But at the end of the day, all that was words when one writes a CV. At the end of the day, one's got to simplify things. That's what I want to tell little children, that you got to simplify things and then the way becomes clear on its own. And that is exactly the reason why I say that I will not hold a didactic lecture, because you can always have a didactic lecture for, and it gets to be very boring. And most of you have a very varied age group, right? 7 to 17 years, and you may be having other adults associated with it. So I wanted this particular, I see somebody raising one's hand, Averi Shahana, right? Shahana, she's raised her hand. Does she want to ask a question?
You just, if you want to ask the question, you ask later on. Okay. Later.
I think that was by mistake. So you can continue.
So if she wants to, it's fine. I mean, what I mean to say is that, yeah, so that can be noted down. No, I see. I am actually an extempo speaker, especially when it comes down to little kids. And I wanted it to be, kind of an interactive session, because I know that all of you have a lot of questions to ask. Normally, it's in fact my first experience to give a talk for little kids, who are really out of sync of ophthalmology. Strabismus, I'd like to clarify. Okay, that is my specialization. In simple words, it means It means what? It means squint. It means stedapan. Okay. I mean, if I'll be using a little bit of, we are all used to using a little bit of Hindi along with English. And I would try and use some Bengali also because my father is a Bengali. So I would like to try and practice it out. I can speak pretty good Bengali actually. But then, so that's how it turns out. But, it's a simple term called do all of you. Now I want all of you to interact, all the little kids. Do you understand what squint is? I want you to ask questions. Do you understand what is squint? When you say, maybe in Bengali, as you say that chokta tiara chilo, what do you know what that means? That is all that it means. That is chokta tiara thake na. Mane, you don't look quite straight. You're looking somewhere towards the right or the left. Jisko common parlance mein bola jata hai. Not very nice to speak of it that way, looking London, talking Tokyo, So that is actually a very colloquial way of saying it, a little bit derogatory. So I will not use that, but I'm sure all of you know what that means. And I hope you do not laugh at your little colleagues who do have it, because it is a significant problem that affects children, about 3 to 5% children in the world. And though there are no specific South Asian data, now I want to specify South Asian because we're all South Asians. When you talk about the Indian subcontinent, then geographically, the World Health Organization, has kind of classified us as South Asians. And that actually, basically, it has a kind of a genealogical or, a genetic origin also, if you talk about it that way. Like, so if you talk about the part that is, south of the Himalayas, that would actually mean, say, India, Bangladesh and Pakistan, and some other areas in Southeast Asia that goes across. And that is what we are, we are South Asians, right, geographically. So compared to the huge amount of land that, compared to the, relatively less amount of land that we have, the population is huge. So it's a significant population. And hence, it is categorized separately by the WHO. So while we do not have what we call specific South Asian data, still strabismus or squint, strabismus is the most scientific term, right? And squint in common parlance is what, I hope I'm not speaking too fast because I like people to interrupt me. I hope it is okay with all the little kids I see out here. About, see, that's what I wanted to say, that I wanted it to be an interactive session. So all of you are...
So what Dr. Chaudhuri meant, like, if you don't understand something, you are free to ask questions. Tomra proshno jigesh korbe, kono oshubida nei.
I just want to make it very simple, and I in fact would be taking questions from you. That is what I want. But because you would want to know what's
someone raised hands
so
actually.
Ankita
Kaur and Bikash Roy. Tomader ki kichu question proshno ache?
Please, because that is how we go ahead. Yeah, tell me.
Proshno thakle tomra unmute kore jigesh korte paro.
You can ask right now. I mean, I'll try my best to speak. Am I going too fast? Am I going too fast?
It's okay, ma'am. It's okay, ma'am.
You can understand. The small kids. So tell me, Ankita or Bikash, yeah.
Ma'am,
Ankita, you can tell me.
Your squint eye, ma'am. What is the treatment for squint eye?
Okay. No. So now we have not even started off with squint. See, you have what is called, when we talk about all of us being humans, and I'm sure all of you do mathematics in school, and you'll do it later also, then we call something called a statistical significance of things, where something is normal, and what is normal can show huge variation, right? And it is only when you go beyond that variation of 67% would you be called abnormal. So there's a huge variation between what is called normal. So now when we talk about our eyes being together, anthropometrically you would know that we didn't begin like this. It's only when we talk about primates, and primates would mean say, like, besides humans, you have only 3 other primates. That's chimps, chimpanzees, orangutans, and gorillas, right? Where we have eyes which are straight, right? And this evolved over time so as to allow us to do fine work. When the eyes are placed, in such a way that they're aligned together, you're able to actually, there is a very small little disparity between the images seen between both the eyes so that you can do fine work together. Now, it is done at the cost of loss of visual fields on the sides, just because we can do this, it limits our visual fields on the sides, but we are able to do fine work together. Both the eyes are able to work together so that we can do fine work. Now, when we talk about other animals, say other mammals, for example, like dogs, for example, they have eyes on two sides, and same with tigers. And even with cats, though they appear to be having eyes which are straight, or owls, they actually are not coordinated to produce what is called a single image in the brain, right? So now, since we know that we developed, as we developed over time, so this is something that occurred where both the orbits placed on both the sides, gradually as the embryo grows, in the mother's body. So they kind of move, about the 4th month or 5th month, and they come ahead and become straight. So that's one reason. If that does not happen, or sometimes even if the orbits are normal, if the eyes are not placed in the right orientation to each other, you have what is called a malpositioning of one eye to the other. Okay. And so this is seen, as I said already, in the global data says about 3 to 5%, right? But in children who have intellectual disability, it is much more. It's about 30%, because as they say that there are certain centers in the brain which really need to work together to produce this alignment. And it's very beautiful when both eyes can work together, and you can do so much more work, which we train ourselves to do, right? So when you have squint, it actually means that though you might be having an absolutely normal eye structurally, they are not working together. So in spite of having both eyes, only one eye is working at one time. So actually you are not able to use, you're not able to get the benefits of binocularity, which is truly a gift, for doing any kind of fine work, right? So that is the reason why, because many people just take squint to be something cosmetic. Of course, everybody likes to have eyes which look straight, and that is how we epitomize beauty. Though of course that translation of beauty differs, in different civilizations. For example, in the Mayan civilization, they actually produced an inward squint. They would kind of go and squeeze out the nasal part so that the eyes would go in inward, because they said that that was something, that the gods had, their gods had. And or even in, there are parts of India where it is considered to be very lucky. So they say that, if you have a squint, do nothing about it because it brings in money, or so those are different things which you have. Those are societal norms with which, because we live in society, so we go with societal forms. And of course, that forms one of the main basis as to why many patients present late. I will say not just in India, but yes, they do present late in India, but that is largely changing because the essential part is one understands that strabismus or squint is actually a childhood disease. And if you are able to work and kind of straighten out the eyes when the child is young, then the chances that both the eyes will be able to function properly, and they would be actually they would be able to function together is higher than if you align these eyes at a later age, right? So once again, so first of all, the answer to the question which Ankita asked was that, is squint correctable? Yes, squint is correctable, but it depends on what type of squint it is. Now, I'm not going to go into a detailed analysis or a detailed eulogy on the types of squint, because it is beyond the scope of a public lecture. This is supposed to be simple. I'm not supposed to be talking about complicated things. So it is something where both the eyes are not aligned together. There are many reasons for squint. We can classify them in simple terms as being primary or secondary. When we say primary, we mean, as with any kind of disease, that we do not really know the cause, but it occurs. Secondary is when it's secondary to something, because that when we talk about our eyes moving together, then we know that there are nerves which are supplying it. Okay, so if one of those nerves, these are cranial nerves, and if any of those nerves don't function, then you may develop a squint. Okay, or you might say, suppose get thyroid eye disease, when the muscles become very thick, and then they don't move, right? So then you can develop a squint. So misalignment can be secondary to a particular cause, either neural or restrictive or endocrinal or any other thing which affects the body. But at the same time, if it is primary, that is without any cause, that is essentially a cause that of childhood, it causes significant childhood morbidity and is hence of significance. Now, we are trying our best to understand the causes of primary strabismus, because you see, one of my work is related to that. We do see familial patterns of it. So my doctoral work and subsequent funded work is also based on genetics of strabismus. I'll not go into that. That's outside the scope of this talk. But the point is that first is to find out the cause of something. If you know the cause of something and you can modulate the cause, you may see to it that it doesn't happen. Until that time, you of course go and see as to how you can symptomatically treat a patient. Okay, so whenever you treat somebody, there are two ways of treating. This is an essential paradigm of medicine, that one is etiological and the other is symptomatic. Okay, now when we say symptomatic is, suppose I've got irritation in my eyes. Yeah, we'll come to that, Bika. Okay, so if I say that I've got irritation of my eyes, so irritation of my eyes means that, okay, first give me a lubricant, or let me not look at a screen for a very long time. I take a break in between so that my eyes do not water. Right. The second is actually finding out the cause of the dry eye disease. Okay, and trying to treat that cause so that it doesn't occur again. Now, 70% stuff in medicine is idiopathic, or where the cause is not known, or primary idiopathic, or whatever may be, whatever is the term that may be used. So the management is symptomatic. So till we find out the causes of primary squint, what we have been doing is symptomatic management. Now, symptomatic management, that is aligning the eyes, can be surgical or non-surgical, right? Okay, so non-surgical means that many times it's been seen that this particular type of squint is basically a result of a high eye power. Okay, many of you wear spectacles, so it is a result of that. So you can modulate it optically. That's why you have to see those patients, those children, evaluate them, usually doing a refractive correction or correction related to testing out the eye power, okay, of the subject, and accordingly prescribing it. And then, of course, this is different from the, say, for example, the power of glasses that is given by the optometrist, the local optician or something, because they may not actually know how much to give under these circumstances. For example, if you have inward going squint, then you have to give a much higher number than what you would normally give to a child with the same kind of refractive error. So those are certain nuances which is known to a strabismus specialist or a squint specialist. And after that, the child follows up. If the child responds to the optical treatment, then under those circumstances, there is no surgery that is done. Otherwise, the patient has to undergo surgery. Now, you also have to understand, that's why I'm specifically emphasizing that it is not as if, surgery is something, because people tend to put a lot of, emphasis that, wow, it's surgically correctable. No, both surgery and non-surgical means are basically a means to an end. The end is that your eyes should be aligned, right? So whatever causes your eyes to be aligned, or whatever results in that, is what you do. If it can be non-surgical, well and good, because it is again one of those paradigms of surgery, of medicine, whereby that if the most non-invasive procedure is the best, right? That is how you go about it. If you can do something without, a lot of blood and grime, that is best. Okay. And if it is obviously necessary, then obviously you'll have to operate. That is it. And the essential aim is that both eyes should be aligned to each other so that they can subsequently function together. So the basic idea of motor alignment, of putting the eyes together in straight gaze, is so that you can stimulate the eyes to work together, so that, because actually all that is taking place in the brain. Eyes are just like a camera shutter, so that whatever goes in together goes and functions in the brain. But if the two eyes are not aligned to each other, then obviously the images that are reaching the brain are different, right? So have I answered your question in a synopsis, saying that, is it correctable? Yes, but you need to customize your management to the subject or the patient that is seen. And that is where the specialization on your knowledge of the particular subject arises. So is there any other question that you would, does it answer your question? Okay, there was Bika who asked in between, I think.
Bika,
There was a girl,
Bika and Arjahi both want to ask some questions.
Yeah, I know, but Bika, I think, okay, so
Bika,
whatever.
Bika or Bikash, probably it's written as Bika. তো তুমি তোমার কিছু প্রশ্ন আছে? বিকাশ হবে।
She was there anyway.
তুমি হাত তুলেছিলে?
তুমি কি কোনো প্রশ্ন করবে? বিকাশ রয় যেখানে আছে, আনমিউট করে প্রশ্ন করো, আনমিউট করো।
হ্যাঁ, ও করেছে আনমিউট।
আচ্ছা,
প্রশ্ন আছে? আচ্ছা, ঠিক আছে। Arjahi, you have a question?
Yeah, I have two questions. First, how do we protect our eyes? And why we put eye drops to protect our eyes?
Okay. And how do you protect your eyes? Ka kya matlab hua? Eyes are protected by the eyelids? Like, what exactly do you mean by that question?
She probably means that how to take care of your eyes, right?
That's what I would want her to ask. What does she mean by it? Because what do you mean by that? That's why I asked you.
Let her.
See, I basically, as I said, I'm a pediatric ophthalmologist. So so vast number of my subjects are children. And I, of course, deal with both intellectually able and intellectually disabled children. So that is one of my work. Of course, I look specifically at the eyes. So, I always say that a child above 5 years knows exactly what he or she wants to say, right?
Yeah.
So I never let their parents interpret for them, right? So you know what you're asking. So you ask me what you want to ask, because only then will I be able to answer you as to what you wanted to ask. Otherwise, anyone else, including me, if I interpret for you, then I'll be answering my question, not yours. So yes, Aryahi, that's a complicated name. Aryahi, tell me exactly what you mean by protection of eyes.
আমি বলছিলাম যে আমাদের চোখকে রক্ষা করার জন্য কি করা উচিত?
চোখের কাছে তো রক্ষা আছেই, একটা eyelid আছে, you can close your eyes and your eyes are protected. What exactly do you mean? Your question has to be correct. Hello? হ্যাঁ, মানে বলো আমাকে।
Care of our eyes.
So now you asked me the right question. Okay, how to take care of it. So now care can be of different levels. Okay, what kind of care do you mean? Like what? Like what? See, eyes are there. They're like just your hands or just your face or whatever else, So what exactly do you mean, Because eyes, as you know, as I already said, is there in, just one sec, is there in an orbit. It has got a bony margin which surrounds it. In the front, there is an eyelid. So long as your eyes are closed, so long as your eyes can close at night, okay, and so long as you're blinking when they are open, right? So your eyes are protected. Those are natural protections. You don't need anything beyond that. Now, beyond that, what are you trying to ask me is what I would want to know. Hello, yes? I beg your pardon?
No, someone actually unmuted and some noise came from
that's what I say. So
Aryahi,
yes, Aryahi, tell me
bolo.
what exactly is it that you're trying to ask me?
Aryahi, bolo.
Kanki eyes protected thake. God has made it that way. God, in fact, with our body on its own is really a wonderful mechanism of natural orchestration. I mean, it's beautiful when you see the way it works. Okay, it's only when one by one they start going into asynchrony, do you have to take hold of artificial means to kind of bring it back to its normal, the way it was working earlier, and even then it is not good enough. And that is one of the fallouts of modern medicine. I would very honestly say that whatever you do is never as good as what it would have been had it been the way it was, the way you were born with, or the way God made it, so let's put it this way, you try to simulate that only, right? So when eyes are hugely protected, let me tell you that it's a huge ball, okay? It's a ball like a big tennis ball, okay? But it is about 24 millimeters in when you take from the, the anterior to the posterior, those are scientific terms. So let's say from the front to the back, it's about 24 millimeters normal, right? Okay, that's the diameter. I'm sure you must be reading mathematics and you know that there is what is a diameter of an eye. That means it passed through the central point, the central point of that globe. Okay, if we take it as a circle. Okay, and it is hugely protected because it's in a bony orbit, right? So there are bones on either side. So really have to hit your eye very hard, or hit the bones around very hard for you to be injuring your eye, right? So the eyes are protected from trauma. Okay, and you have the eyelids, they close completely. Okay, so because they close completely, again your eyes are protected. Somebody really has to hit you hard against this. And what is very, very essential is that the eye actually, if the eyes, if the orbit is about, the eye is, the volume, it just occupies about 1/3 of the orbit, right? 1/3 to 1/4, which means that even if somebody hits you very hard, the eye is able to move. It's like if you take a bucket of water and you have a ball in there and you try to hit the wall, and the ball can move away, right? It can move into the water into some other place. So the eye has a lot of natural mechanisms by virtue of it, which it is protected now from trauma. Now, I think what you particularly mean is that what you should be doing every day to see to it that your eyes stay clean, right? I think that is what you meant to say. So
Yes,
clean means, yes. So clean means that suppose I do not brush my teeth, then what happens? A lot of stuff, collects in there, food, etc. And obviously that's why you brush your teeth. That's why you take a bath. So every day, of course, it's very essential that you should be cleaning your eyelashes, because there are times when a little bit of dandruff settles on them. Then you have eye glands. Those glands are such that you have secretions coming out of it. So it's a good idea to clean your eyes, but not to be very hyper about it also, that you're always cleaning your eyes, because what you might land up doing is you might be actually pulling out your eyelashes, right? If you do that very often. Okay, so you should not do that. But yes, if you take if you kind of, while taking a bath, say once a day or maybe once in the evening, if you just clean it with a small little cotton swab, the eyelashes, just take a little bit of cotton and clean it, right? And I always actually say that I am not against eye makeup, but I always say that people have beautiful eyes and they really don't need eye makeup. So don't do it unless you really go to a real big party or something like that, So if you're not using a lot of eye makeup, which you do not clean, it's good to use eye makeup, but if you do not clean it, then the small little particles collect out there again in the eyelashes. And again, they cause problems. Okay. So that should not happen, right? Okay. And if you talk about eye drops, no, I will not say that you should use any kind of eye drops just like that. Okay, an eye drop is also a medication, just like you should not be taking, how should I say? Okay, if you're not using a lot of every medication. This is again a principle of pharmacology that has an effect, has a side effect also. Okay, a side effect is an undesirable effect, but which is basically a part of the same mechanism through which you want the effect, like steroids, for example. Okay, you have inflammation, you want steroids, but at the same time, steroids are going to cause peptic ulcer. That's the part of the mechanism of action of the drug. It is the same for eyes. Do not use any kind of medication just like that, okay, if it is not indicated. Okay, so is that clear? You keep your eyes clean with simple water, that's fine. Okay, if you have a problem, go to an ophthalmologist who will specifically look at the problem and prescribe you. Okay, do not keep on using medications on your own. It is just as dangerous as taking oral medications or IV medications. Just do not do that on your own. So there is no such thing called something which you can just use just like that for the eyes. It's a mucous membrane, things get absorbed inside. Okay, so you got to be careful, otherwise you can have side effects, right? Okay. So there's one question coming from Pranab Ghosh, which says, is LED light harmful to our eyes? Now, what specifically would you mean by LED light? Could you specify what do you mean by LED light? What are the things that you're thinking of?
Mr. Ghosh, you can unmute yourself, and if you want to ask question, or you can write in the chat box.
No, he's written that LED light, but I want him to ask what
Yeah,
does he mean by LED
that's
light?
what I am asked him to
Actually,
write it.
I think the yellow light, it is sometimes I also feel when the LED light, everybody in our house also, we are putting LED light because of to reduce our electric bill. But that is the yellow color. I don't like that, and it hurts my eyes.
I know.
Also.
No, it's not actually electric bill. It gives more illumination for lesser power. So that is how it is. So that's why basically that's again when you talk about technology, the whole idea is to be more cost effective. Okay, that is one of those principles. And let me just say that nothing is dangerous. Nothing that is dangerous will be in the consumer market. One thing which I always specify when people ask me things like, we keep on looking at a screen, is there radiation coming from the screen? No, sorry, if there is radiation coming from the screen, how will that particular technology be approved? It goes through many clearances, right? So there is nothing like that. When we talk about LED light, because nowadays even tube lights, you don't have that old fashioned even bulbs, which used to glow like that. You all have LED bulbs. Why? Because say, 20-watt bulb will give you the illumination of 100-watt non-LED light, So obviously you're just using 20 watts. So your cost is decreasing. That's what you meant. That's the effect of it, because you're getting an equal amount of illumination or lesser wattage. That is the physics of it. So what happens is that it gives you that illumination. So you are happy. The point is, it is not particularly harmful. Otherwise, it wouldn't be there in the market, right? But at the same time, the specifics for that is because there are many such other, queries that come out that does it radiate something? Does it do something else? No, sorry, it does nothing. But and it is what is available now. You not find non-LED stuff very, very frequently in the market now unless you look for it, right? So that way, so neither looking at a screen for a long time is harmful, nor LED light is what is the light power in a 12 by 12 minute writing and reading time? What is the right light power? No, nothing. See, that's what I'm trying to say. There is nothing called such standards. Whatever you are comfortable with, okay, at the end of the day, whatever you are comfortable with is what you should be using, right? So no, because I've always seen that no, I should not be saying this, but this is true, that it is true for Indian exams also. People tend to ask these kind of questions where you say that what is the correct thing? No, there is nothing called a correct thing. What you are comfortable with is what is correct, right? Okay, if the requirements of my eyes, if I were 80 years old and I have some kind of retinal thinning and I require more light, say I require 200 watt lights, that's normal for me. If I'm young and I require 20 watts, that's also normal for me. It is where I'm able to function properly. That is what is normal, right? And so this may vary from people to people. Okay, so there is nothing, whatever you're comfortable with. If you're comfortable with, say, sitting with a table lamp, that's okay. If you're comfortable, having 2 tube lights around you, that's fine. Everything is fine. Okay, so it is just that you should be able to function and do what you want to do properly. Right? So that is what is important. 100 watts should be fine. As I said, it is okay. If you are able to use a LED light, which is 40 watts and you're able to do your work, that is also fine. So that's what I said. There is no such definition as to what is okay when you're doing routine, ordinary work, right? Which might be even studying, children studying, or, you're doing your routine housework, anything. They're all routine, ordinary work. So there is nothing called normal. Normal is what you find normal. Right? Yes. So now you said, ma'am, can coronavirus affect our eyes? A lot of research is going on this. Okay, so nobody knows. There are reports here and there. They say that this kind of conjunctivitis, that kind of, nobody knows. Nobody would know about the exact effects that corona had on the body till about 10 years later, because that is when research gets ratified, re-ratified, duplicated, and goes through many peer review processes and then becomes certain. So that is the reason why when somebody writes a huge research paper in a hurry, then almost after 2 months somebody else comes up and says that no, that's not correct, because it's still evolving. See, we are passing through something. Okay, so when you're passing through a particular period, like if you're passing through a war or you're passing through a pandemic, then at that point of time you cannot assess. You can just take in observational data and say this is what happened to me, and tomorrow you sit back and analyze it in retrospect and say these were the effects of that. Okay, so per se the corona has not really been known to cause any either transmission through the eye secretions, okay, or any such specific effect in the eye which can be said that is specifically due to corona or corona conjunctivitis or corneal ulcer or something. But let me clarify one point here, that corona is an ancient virus. It is not that coronavirus is a new virus, right? It is an ancient RNA virus, right? Just like the influenza virus and so many other viruses. Okay, because it's able to mutate, it comes up with strains, okay, which might have different effect on the body, depending on what part it's affecting, right? And that is the reason why you see, so that the term used is protean. Okay, the protean means because it kind of goes back to the Greek Proteus, who could change forms. Or you might have seen all the serials, like jo Rakshas log hote, they could change forms. Humans, unfortunately, because it's so much more evolved, no matter how much mythology tells you, you can't change forms. But a virus can change forms because it's only one small little RNA. All it has to do, it can survive with that. After all, a virus is a non-living particle. It becomes living when it enters you. Okay, so once again, when COVID enter our body from us, I've already specified this, that nothing is known so far. Okay, that it is whether it transmits from the so I've taken that question, Divyanshi, but we will be answering that later. We'll speak on it after. Yeah, so just keep that on hold. Okay, because it's a slightly different topic than what I'm talking about right now. Okay, so when you talk about viral transmission, okay. Okay, so Bika has stopped in between. What did you say? Abar bolo amake ki bolle? What did you say?
আমি বলছিলাম যে চোখে যদি আমাদের আঘাত লাগে তাহলে আমি তখন কি করব?
आघात means trauma, चोट लगता है ना? That's what you mean.
चोट लगा
है ना, चोट लगा ना, that is
लगा
what.
तो
Okay.
क्या करना डॉक्टर
हाँ,
के पास
तो
जाना?
नहीं तो आपको किस किस्म का, देखो अगर आंख में चोट लगा तो उसकी तो ट्रीटमेंट अलग होती है, स्पेसिफिक ट्रीटमेंट होती है. देखो आई ऑलरेडी मेंशन दैट द आई इज प्रोटेक्टेड. थोड़ा बहुत अगर आपको लग जाए तो ज्यादा फर्क बेशि किछु হবে না. बट अगर ज्यादा लगता है कि आंख का से फॉर एग्जांपल बोन या ब्रेक कर गया, आंख के ग्लोब में रप्चर हो गया, then obviously you have to go to an ophthalmic surgeon who will then decide what needs to be done for you specifically. It is not something that you can do. You will have to go to an ophthalmologist, an eye specialist, who will look at you and see what part is affected and accordingly treat it, right? वो होता है, ठीक है. मगर थोड़ा बहुत अगर चोट लग गया है, आंख प्रोटेक्टेड है ना, थोड़ा बहुत आप गिर जाते हो, आपका आंख को कुछ नहीं होता है ना. So that is what. But I'll come back to the COVID question because so that digression ना हो, ठीक है, क्योंकि आपने बीच में बोला. That is why. Now I wanted to kind of reiterate that COVID is not known to spread through eye secretions, ठीक है. And also the ocular manifestations, there have been many papers that have come out. They say that ye hota hai, conjunctivitis hota hai, but any virus can cause conjunctivitis. Reason for that is, what does a virus do actually? Virus is a small particle, okay, which is non-living. It gets inside your body, okay, and gets inside your genome and then gets to be living. And only thing is, now that the virus is inside, so instead of your genes getting the right kind of information for it to go on producing normal proteins, it starts getting abnormal instructions now because the virus has got it, right? So any kind of virus causes increase in secretions, right? So it might be sore throat or secretions thereof. It might be conjunctival secretions. Any mucosal secretions might increase because of viruses, okay? But that does not essentially mean that the coronavirus. However, each of them have specific areas. Like the corona is essentially a upper respiratory tract virus. It's an ancient virus, as I said. It's not something new. Okay, the disease COVID-19, so it's become very famous now, of course, with the name corona, but even the SARS in 2004 or the MERS in 2012, they're all coronaviruses, because it has a tendency to mutate and cause different kinds of, diseases. This time it's, of course, gone on for a very long time because it kept on replicating and, it kept on, forming different variants, and hopefully let's see how it goes. But then that is the basic, genesis of how a virus goes about causing infection. But viruses which specifically affect the eye are actually, say, the adenovirus. Okay, adenovirus is a virus, again, which affects the eye. Specifically, it causes keratoconjunctivitis, right? And then you have the herpes virus. Okay, you know that there's another virus called herpes. Many of you know that when you have fever, you have all these, lesions around your mouth and everything. So herpes affects the eyes again. Okay, so these are two main viruses which affect the eye. They cause, conjunctivitis and corona. Corona is not known to directly affect the eye per se. Though, of course, a variant of corona might, that also their spectrum of disease also keeps on increasing. Okay, so let's put it this way. Okay, so there was one other question, which was Divyanshi asked one question in between. I remember her. Divyanshi, what did you ask?
Ma'am, I asked that after using too much of devices during our online classes, what are the exercise or anything else we can do?
No, you don't need to do any exercises. There's something called, see, there is no exercise that can do away with the fact that you're looking at a screen for a very long time. Okay, let's put it this way. What happens when you look at a screen for a long time? You are basically blinking less. Okay, when you look at something, like accountants do that, right? They keep on looking, they'll work for 4-5 hours looking at a screen. So when your eyes blink less, then what happens is there is less lubrication. When you're blinking or when you're sleeping at night, your eyes are lubricated. I already said that the eyelids are a very big protective barrier for, for the eyes, for the eyeballs, right? When you keep on looking at a screen, you blink less, right? So when you blink less, then what happens is that there is severe dry eye. So that dry eye causes, irritation. Imagine that if your skin were very dry, you'll try and scratch it. So then you start rubbing it. When you rub it, increase the problem, but the moment you rub it, you're traumatizing the epithelium and there are inflammatory cytokines that come up that cause more irritation. So that forms a vicious cycle. There are two ways in which you can, it is in fact called computer vision syndrome. Okay, it is, so there are two ways in which you break this cycle. And I always say this, and this is one of the managements that we do. That is after 1 hour of screen time, okay, take a 5-minute non-screen break. Now, I'm in fact going on to this fact, as I say, why I say screen time and not computer time is because, okay, once there was this patient who came and he said had all the symptoms of a computer vision syndrome, but he said, I only do computer work for 1 or 2 hours. He was very emphatic and we were wondering what it was all about. But then he landed up saying that, oh yeah, I see movies on my mobile for 8 to 10 hours. Okay, a day. So you understand what I mean. A screen time is you're looking at in fact, at this, it's a small computer in your hand. Everybody has a smartphone nowadays. You just pick it up and you keep on looking at it and, you're not blinking. So it's the same thing. So, it's all the devices where there is a screen. Okay, because most of you in this generation would really not be looking at paper books anymore. You'll be looking at screen books. Okay, so this is one thing which you need to do, that you need to decrease your, you need to take a 5-minute break, just a 5-minute break after 1 hour of screen time. And that is adequate. Along with that, you can, of course, supplement it if you have dry eye, depending on the extent of dry eye that you have, supplement it with, say, some lubricating drop. But as I said, a lubricating drop should not be used just like that, which is something which one of your colleagues asked, because lubricating drops have preservatives in them. And many of these preservatives, can be dangerous. Like you keep on putting it, they form eye deposits, they further cause further irritation. So you should never use anything just like that. If it's indicated, yes. Okay, otherwise simple preventive measures like, as I told you, but okay, after say 1.5 hours of screen work, just take a small break. I'm sure even your classroom schedule allows that. You have a break in between. So just do not do it like that, after 1 hour, you still keep on working on the screen. Just take a break, roam around, look out of the window, talk a bit, get back to it again. And that is it. That's about it. Okay. And there was something else which somebody else asked shortly.
Thank you, ma'am.
Okay. Okay, right. Okay. Now, life should be simple. Okay, it should not be complicated. Okay, so yeah, somebody else asked me something right now. It came as a chat. I mean, shall I go through the chats?
Ankita actually asked 2 times that whether if there is a hole in the retina, what can be done? Okay, so are you asking this specifically for yourself or somebody you know? Because that's a very specific question. Ankita,
what is it exactly that you want to know? Yeah.
Yes, ma'am, my father have it.
Okay, so your father has a high minus number. He's a myope. Like minus number है, मतलब चश्मा.
Ma'am, positive power है. Ma'am, दोनों ही है. Ma'am, negative भी है, positive भी है.
No, that means you do not know it very well. Positive होगा वो pass के लिए होगा, but negative number उनका दूर का होगा. ठीक है? So what happens is that when you talk about the retina, has he shown himself to a retina specialist? Because that is what he should be doing. Who has told him that there is a hole in the eye? This is not something that you can find out just like that without somebody looking at it and telling you. So he's been to a doctor?
Yes, ma'am, he went to the doctor.
He went to the doctor. So what symptoms did he have? Did he tell you? Like, why did he go to a doctor?
Ankita, your father can also come and ask. No problem. Okay.
No, you tell me what you know, Ankita, what you know about it, because obviously you can tell you, but what do you know about it? Because you asked this question, obviously you're concerned about your father. So
Yes,
why did he go to an eye doctor?
Ma'am, he had irritation and hazy vision.
So he basically went for irritation and hazy vision. You can have both if you have a small chashme ka number, but okay, a change in that. So while a routine examination was done, it was found that he had a small hole in the eye. Okay. So I'd like to tell you one thing that, we have what in East Asia is called a myopia pandemic. Okay. We do not have it to that extent in South Asia. Say, for example, if you go to Korea, then about 90% people have high myopia. High myopia meaning, say, minus 10 or more. Minus 6 or more is what we define as high myopia. But they all have minus 10, minus 12, things like that. Okay. Now, in fact, at one point of time, the South Korean population was, say, 96% of them have high myopia or myopia of some kind. Okay. This is true of China, Japan, and, what we call Southeast Asia. Why it's occurred, one does not know. There are many postulates, and it's also, of course, one of those areas where a lot of current research is going on. But having said that, in the Caucasian population, okay, or what we call the white population, it is about, about 15 to 20%. And we come somewhere in between, 25 to 30%. So myopia is a problem amongst us, but not really that much of a problem, especially high myopia. Now, what happens in myopia? Okay, why do you have have myopia. Now, I told you that the eye is like a tennis ball, the eyeball. Okay. But now just take it this way, that if you elongate the tennis ball in one direction, so it becomes a long, kind of an oval-like thing, right? So that now the anteroposterior diameter or the diameter from the front to the back is no longer 24 millimeters, but say about 25, 26, 30 millimeters, right? It's oval. Okay. So when you have this oval shape, there is a structural change that is taking place in the structures within the eye also. Okay. So a normal retina gets stretched. Now, suppose you have, chadar nahi hota, you have a cloth at home, a bed sheet, try stretching it, it will break somewhere, right? Because it can't be stretched beyond a certain limit. Okay. A bed sheet can, of course, be said to be inelastic, but suppose you have something a little bit more elastic, but you try stretching it so that it fits into the contour of the room. Let's put it this way. Then if you stretch it too much, it's going to break somewhere because it cannot sustain it, right? So that is exactly what happens to the retina, that after a while, it just kind of, breaks down when the eyeball shape becomes very large. So that's the reason why retinal detachments or any kind of retinal problems are much more common in people who have a high minus number of different various degrees. And therefore, that is why it is indicated that a myope should always get an eye test done for checkup of the retina at least once a year. Okay. That's called indirect ophthalmoscopy, where the ophthalmologist dilates your eye and dilates the pupil and basically sees each and every part of the retina to look for these small little holes. Now, when it comes down to holes, all holes are not dangerous. Okay, you can just have a small little hole like thoda sa chadar fata hua, it doesn't matter, but a large hole can definitely lead to other complications like a retinal detachment. That's why this needs to be checked regularly by a specialized ophthalmologist. So that is what you need to do in such circumstances, and that is what you can probably tell your father. So if he has gone to an eye doctor and he is within that eye doctor's supervision, that's a good thing. Is there anything else that you want to?
Ma'am, the doctor asked him to do a laser. So, ma'am, is it important?
So that's what I'm trying to say. This is where you're asking a very general question about what has specifically been told by that particular. So here I'm not prescribing. I have not seen your father, right? Okay, so I cannot comment on what a colleague has advised you in a fiduciary capacity. Fiduciary capacity means it's a capacity of trust. He's examined you. He or she has examined you and given you advice. I cannot make a lay comment on that. Okay, I can tell you situations. So if your father has gone and has been examined, and then upon an examination, if the doctor who has seen him specifically has advised something, then your father has to follow that particular doctor, or if he chooses to, he can go to some other doctor because it's his body, the consent is given to the person, and take a second opinion or a third opinion and then do accordingly, right? And at the end of the day, it is his decision. It's his consent that is taken as to what he wants to get to win. But I cannot make a lay comment. You understand? Because you see, without having examined him, I cannot make a lay comment, right? So I will not go further on this because that is something, it is one of the recommended managements in some kind of poll, some kind of tiers, but I do not know your father's case, right? So I will not make a lay comment just like that, right? Okay. Is there anything else that you would want to ask on this issue? I just made you understand that what might have happened. Okay. And under those circumstances, obviously he needs to go to an ophthalmologist. And after that, whatever the ophthalmologist tells him, or maybe a second one or a third one as he chooses to, but somebody was to examine him. Okay, not me, because I've not seen him at all. Right? Okay.
Thank you, ma'am. Yes, ma'am. Ma'am, how can you control our power from further increasing?
Control our increase in eye power. How old are you?
Ma'am, 15.
15. And what is the power of your glasses that you use if you use them?
Yes, ma'am. Ma'am, in one eye it is negative 1.25 and in another one it is negative 0.5.
So you don't have much of a number at all. Okay, that is hardly anything, right? You have anisometropia. There is a small disparity between the power of both eyes, but it does not preclude the working of both eyes together. Sometimes it can be a difference.
I also have squint eye at the same time.
Okay, so that is quite common with anisometropia. Then you need to show a squint specialist, right? Now, before that, I cannot comment upon that because you see, until, as I told you, till I've seen somebody professionally, I cannot see. This is supposed to be a general lecture where I give you guidelines as to what you should be doing, either at your same area or somewhere else. Okay, wherever you think best, you should obviously be showing a swing specialist as to how your eyes can function together. You can always have anisometropia without a squint. You can have both together, as in your case. You can also be having amblyopia. I do not know. I do not examine you. I have not examined you, so I do not know whether you have lazy eye or not. So these are specific situations that you're asking me, right? And they need to be seen by a ophthalmologist who is examining you particularly, right? There are many variations to the theme. Like if you show me, then obviously in a fiduciary means that is which is confidential, then I'll give you certain advice. But here it is a very general forum where I've not even examined you. So I cannot comment on this. I can say that yes, indeed, if you have anisometropia, which means, two different numbers in both the eyes, that means the size of your eyeball is probably, it probably differs. One eye is slightly longer than the other. Then the second thing that we have to see is whether these eyes are capable of working together. Now, if you say additionally you have squint, then the squint also would require correction either by optical or by non-optical means. Okay, optical would mean the non-surgical mean, or non-optical would mean the surgical mean. That needs to be decided by a treating strabismologist. Okay. So if you were to show me, I'll be able to opine on that. Otherwise not. Okay. Right. Is there anything else that you would want to ask? I see. Yeah. So you should go to a strabismologist and show.
And Demira Mukherjee, 2 hands.
No, there's Manju ma'am also asked lying on back, like what causes inflammation of an eye and how it can be prevented.
Inflammation of an eye would mean what? Like again, what do you mean by an inflammation of an eye? Are you talking about certain situations in the eye where on its own, the eye gets inflamed? Say, for example, the eye embryologically, okay, again, here it is very, very important. The eye basically derives from what can be called the neuroectoderm, what forms the brain. That is what comprises, the optic nerve. It's a part of the brain. Okay, and then you have a mesodermal, a mesodermal component. Okay, a mesodermal component is where you have things like, you have, the iris, the cornea, the posterior part of, the part of the cornea, that is the area through which the light goes inside the eye, which is transparent, and all of these, so now what happens is that the iris, okay, and the choroid, as it's called, is a part of the eye. They have a common embryological origin as that of the the synovial, the joints. Okay, so there are many such disorders where you have autoantibodies, like rheumatoid arthritis. Okay, specifically rheumatoid arthritis affects little girls. Rheumatoid arthritis is associated with what is called pauciarticular, and you have multiarticular. In fact, the multiarticular ones, which affects more of the joints, affects the eyes less, where the target organ is the joint. But the pauciarticular ones, where less than 5 joints are affected, specifically affects the eyes. And they say that the target antigen is basically that neuroectodermal ancient, the old embryological, whatever the target, of that particular auto antibody, which affects it. And so they have severe inflammation, which is almost a blinding disease. Pauciarticular rheumatoid arthritis comes up, little girls come up with, severe inflammation of the eye. Then you can have severe inflammation of the eye, which is idiopathic. Idiopathic would mean that, okay, as I told you, 70% of all diseases is idiopathic. You just have inflammation of the eye. It usually gets treated by steroids. And again, one has to be very careful that you have to keep a watch on this inflammation, so that, and because if you keep on indiscriminately using steroids, then you can suddenly have an increase in intraocular pressure. Okay, so there are side effects to it. So it has to be done under the supervision of a physician, right? And then you can have certain other conditions, like, for example, in young men, the 25 to 30-year-old, which is called ankylosing spondylitis. There's something called an HLA B27 uveitis. For example, HLA is a particular type of antigen that's present in the body. It's present in almost every blood cell or leukocyte of the body. And they say that, when this HLA B27 is affected, again, the target organ is the eye. So your specific types of uveitis. And these are associated with something like, for example, sometimes, it's called ankylosing spondylitis, that, there is fusion of the bone. Specifically affects young men, young men in the adolescent age group, 15 to 20. So if you suddenly have a child who's not able to get up, say the first sign is that the child, a boy child, a male child of 15 or 16 years would say that I'm not able to get up. very uncommon in women for some reason. Okay, 8:1 ratio hota hai. So this person is not able to get up, say from a sitting to a standing position, say many of us are used to, sitting. I'm very fond of sitting, cross-legged, so that way. So suppose you're not able to get up. So especially specifically when you were young, 15 or 16 or something like that. Okay. So then you should, and you have some kind of, this haziness and vision and all that, then you should think of that. Ankylosing spondylitis, right? That can be very debilitating because obviously your spinal cord simply fuses. So you're not able to kind of move around. See, the spine gives us flexibility, doesn't it? We are able to move around in different direction because our spine is, wrapped around in spinal fluid within a vertebral column. So it's safe, relatively safe. Everything in our body which is important is safe. You've got a skull out here, you got something really heavy. But of course, if the amount of trauma is such that it breaks the skull, obviously you'll have problems. Right? If you fall down from the 5th floor and the skull, it can't sustain that much of, energy or force against it. But otherwise, when you're talking about spinal cord, it is actually floating in, spinal fluid, cerebrospinal fluid within a vertebral column. So it's very safe because it can move. But suppose it kind of ankylizes, or ankylizes means it joins up. Then the vertebra is fused, the spine cannot move. So you cannot move, you'll have problems. So there are any kind of variation, whether it be the nerve, whether it be the fluid, whether it be, the bone, whatever goes wrong can cause dysfunction. Okay. The effect may be the same, the causes may be different. And amongst the causes also as to what caused that cause might be different. And that is how, medicine goes forth. Right. So have I answered your question or has it gone too far? I mean,
no, you have just one question. I mean, I have been suffering from it for the last few months, and I was treated with both oral steroid and steroid eye drops. I had many eye drops. One of them was steroid. Anyway, I was cured, and in less than 2 months, I think it's come back again.
So that's what I'm saying. See, basically the point is,
it's not curable then. It's not curable.
No, I understand. Yes, exactly. As I say with dry, but many times as with diabetes, I know you're also blinking quite a bit as I can see. So maybe you have dry eye also, right? Because that is what you do. Sometimes, when you kind of squeeze a lot, people say, but that is because you have dry eye. But I'll come to that. So now I'll come to other causes of uveitis. So that's why I wanted to know why you specifically asked this question. In India specifically, because it's a tropical country, then there are infective causes also. These are not common in the West. But say tuberculosis or other things. I'm not saying you have it. You possibly just have anterior uveitis, but you have been, obviously a huge panel of blood tests have been done for you. They must have been done for you by your prescribing doctor so that, plus minus around that. Now, what, as I say, that 70% of uveitis is idiopathic, means the cause is not known. Okay, which means that whatever was inciting that inflammation still exists. Steroids are giving you symptomatic management. Okay, so that it is suppressing that reaction, but you cannot give steroids forever. And once you start decreasing it, gradually that inciting inflammation comes up again because it always existed. And that's why you have recurrences. So recurrences are common, right? And that cannot be held. I always give an example of diabetes. Say for example, that for a diabetic patient, many of us have it. Okay. So for a diabetic patient, you are normal with the medication. You are not normal without it. Right. So I always ask them to remember that. Okay. Because you see, if you think that you're normal and you stop having your medications, then obviously you're going to go into something which is not very nice. Now, when you talk about uveitis, one has to remember that the condition is not going to go away. It's there. When you have more of it, okay, then obviously you need some management so that you can function, so that it gets back to normal. It will stay normal for a while. But again, the inciting inflammation, which is idiopathic, has not gone away. Okay, so that is the reason why you do have a very high rate of recurrences. And again, the management is symptomatic. The reason for that is the etiology is not known. If you knew the etiology, you could stop it. But most of the time, you do not know why it's occurring. So you're treating the symptoms. So that's the reason why you have it. It's unfortunate, but true. But once you accept, see, the point is, I've always seen this, that in my practice, I'm always truthful to the patient, which means that is many times people say that, or they have their, I always say that a patient who comes has a reasonable amount of intelligence, okay, which basically means that if you're trying to make a patient feel better and it is not so, then the patient is not going to believe you, because he's an intelligent human being. He may not be technically trained, but he's an intelligent human being, right? If you're honest and you tell the limitations of what already exists and give the truthful expectation, then obviously you also understand that, right? That yes, this is what I expect, and you incorporate it as a part of your life, and you're able to do whatever you want to do instead of going on wasting time. Because what happens with an uveitis patient or with a patient where there is a lot of recurrences, they'll go to 5 people, 10 people, because you're looking for a solution, panacea that it stops. But if you know that it's not going to stop, then you'll be happy doing just this, that do whatever, functional work that you can do. And when you have a symptom, then you know what is to be done. But once again, I will also say that please do not self-medicate. You should have a trustworthy doctor, your own physician, so that whenever you have the symptoms, an uveitis patient or a patient with optic neuritis immediately knows when those symptoms are, start increasing. Go immediately, so that you abort the particular, reaction from becoming full-fledged, so that you can get back to normalcy soon. But you will unfortunately not be rid of the doctor. No. Sorry. Okay. That's how it is.
Thank you. Thank you very much.
May I ask you a small question?
Yes, please.
Actually, there are a few more questions. Should I go through? Or?
Absolutely go. I mean, as I said, I keep the evening free. That's what I said. I mean, whatever, that's up to you. I'm okay with it.
Okay. Pritha, you can ask maybe first, and then I can go through the.
Actually, I am facing a nerve is blinking. I am having a tingling sensation all the time in my right eye. So that's the
tingling sensation where?
In the just in this place, in the right eye, above this, just like it's blinking all the time.
No, so in that case, you need to show an ophthalmologist. He probably needs to invert your eyelid and see whether there is a foreign body or something. When have you been having this symptom?
No, this is I'm having for last few days.
That's what I said. So you need to go to an ophthalmologist. Probably there is a foreign body or something. Okay, or maybe you could give it a good wash and something will come out. But actually, you need to go to an eye specialist. They will invert it. See, for example, wo eye ko ulta karke dekhenge. If there's a foreign body, it can be removed. If you're having it in only one eye for 2 to 3 days, it's highly likely that it's a foreign body. Okay, it goes and lodges in there in that cul-de-sac, and so you may not actually be getting irritation over your cornea. But if it is a recent symptom, then definitely please go and consult an eye specialist who kind of inverts your eyelid and has a look at it. Or what you could actually do is you could actually wash it up. Maybe it will go off on its own. I suspect it will be an eyelid. It will be if it is unilateral, only in one eye for a few days, then you should go to an eye specialist and have a good checkup of your eye, the anterior segment of the eye. That is what I would recommend. Yes.
Okay.
Now there's somebody who says how to keep my left eye safe from that. What is this whole question? Just
let me first go through the other questions and then
please,
come back to that.
Okay.
So one of our children asked, like her school has 40 minutes each class, and she has 6 classes, so it's close to 6 hours a day. And she's worried that it can be unhealthy for the eyes, and she has asked what to do, or if it's unhealthy.
I know that my school time is from 9 to 3:30, and we also had 6 to 8. It was never unhealthy for our eyes. So I always wonder that sometimes I'll be very, very specific for this generation, that sometimes when you think too much, it's not very nice. Okay, the point is, as I say, that when you are working more on an online media, just take that 5-minute break. Let's put it this way, there is nothing special about humans in this era than what was not special about them, say, in a previous era, right? We're all the same anthropologically, for the last, 10,000 years or so, we have remained more or less the same. So that's how it is. Okay, the media here is online. If you're physically going and working on a board or something, okay, so then there are certain advantages to that you're not looking at a screen for a very long time. If you're actually having, as for the past 2 years, most children have had online, classes, because, it's not something.
I think she is specifying about online classes.
So that's what I said. So that's what I said. So you say, I already told you that you can't help that, can you? See, you got to go with the media that you have, right? And so for the media that you have and what exists, and you got to facilitate yourself and put yourself within that particular scheme of things. And as I already said, after 1 hour, you have 6 classes. I'm sure you have a break, 40 minutes ke baad, I'm sure 10-minute break hota hoga. And it is not that they make 40 minutes altogether, na? So that is why 40 minutes, that 10 or 20 minutes break is when you should go around, play around, and get back to the next class. Fine, that's all. That's all that is required. Okay, ask an accountant who works for, जब वो income tax देना होता है December 31st से पहले वो 20 घंटा काम करता है कंप्यूटर के सामने. So it is not something that is there for children, it's there for everybody. Everybody has to work with a screen. If you would not take these small little precautions, then how would anybody work? We have to work on screens.
So basically take break in between.
Yes,
and
that is what the message is.
And clean your eyes, and if you think.
That is it. Yeah, nothing else. You don't have to over medicate yourself, put a lot of drops. Just take that little break, give your eyes that break. That's all. Okay.
And one of our members, she is also a doctor, actually, Chitra ma'am. She has asked, what is your opinion about use of dilute atropine in myopic children?
Okay, so as I told you that this has happened in East Asia, not very common in South Asia. Okay, East Asia, as I said, that somehow this has been a myopia pandemic, like for the past 30 years or so. China, Japan, Korea especially, okay, and you just have had this huge elongation of eyes, and they do not know why. They said possibly it could be because they are studying a lot. This was when I was a kid, that used to be said a lot, that if you study a lot, you will have more myopia and you won't be able. So that is fine. All that is fine. There are many theories, both genetic, because it's also been seen that, genetics works for myopia, that if you both parents have myopia, then the child also lands up having myopia. So there are two schools of thought, and they're always, there is a conflict between the two groups, which kind of says to why there should be myopia. Right. But the group which believes that it is essentially environmental, okay, that group, because you see the essential end here, this means to an end. The essential end here is that you should, irrespective of your myopia, you should not get structural changes that can destroy vision, like retinal detachment, as I explained earlier, okay, so that you are not able to function. Also at the same time, okay, you should be able to see properly, because when there is so much of a structural and retinal change, itna patla ho gaya retina that you have what is called pathological myopia, there are so many changes, it precludes vision. What is important for the eye? That it should be able to support vision, and vision is important so that you're able to function. So that's the end. The rest is all a means to an end, right? So there are people, there are many theories would say, so once you know that something is structurally becoming very elongated, you know that you have to control it somehow, the shape, so that you do not start having structural changes that can preclude proper functioning of the eye and do away with vision. Okay, so that is the important point. That is the end. So that is why it has been seen 0.01% atrophy in this study. It's basically called Atom 1, Atom 2. Singapore ka study initially shuru hua tha. There are certain Indian partners also. Myopia is not my specific interest, but yes, because in the sense that because we do see it, I do not use atropine, okay, but in the sense that a few colleagues do, right? And so as such, I do not know what the Indian study would be, but in the Singaporean study, that's called Atom 1 or Atom 2, Atom 3 and all that, whatever, that is atropine in myopia studies, as they would say, they saw that if you use very diluted atropine, that because atropine has a certain effect on what is called the ciliary spur, it kind of contracts that, the eyeball increase is decreased. That is what they've observed in long functional studies. Okay, and this has specifically been seen in East Asian population, so the South Asian, correlate is something which I would not be able to say, because specifically there are no studies from India, but there are partners to the Atom studies. But as I said that in India, you do not see that kind of pathological myopia that is being seen in the East Asian population. It's a blinding pathological myopia that is being seen in them. So it has relevance there, and they have shown it to be effective. So yes, I would say that under those circumstances, yes, in that population, it has been shown to be effective. In our population, I will not be aware of the data. So I would not be able to comment further, but there are colleagues who use it. I do not use it because I prefer to give refractive correction and keep on doing, keep on looking at the retina and seeing whether, they have any such problem or not or whatever. Because I always say that overuse of a medication for a very long time has its own set of problems, or causes its own set of problems. And atropine is basically an ancient drug again, and it has many side effects. So I do not, because what happens is once you start using it, the child is growing up, the parents keep on using it. Suppose the child is not there with you, sometimes they keep on using it for a very long time, and there are many side effects associated with that. So I do not actually use any kind of long-term thing.
And Ankita is very much thinking about her father, actually, very probably. And she has asked again that her father has HLB 27 positive. I don't know
Because
what
I
is
mentioned that. HLA 27. So now she has read
but no encephalitis spondylitis. Will it affect
ankylosing spondylitis.
ankylosis? Yes, ankylosis.
Yeah,
Sorry,
that's terrible.
ankylosis. Spondylitis. Will it affect the eye?
No, so tell me, how old is your father? How old are you, first of all? How old is Ankita?
Ankita, you can unmute.
Ma'am, 15.
So you're 15 and your father is, how old is your father?
Ma'am, 47.
So he's 47. Okay. So let's put it this way, that he's much beyond the age when it could have caused a really severe incapacitating disease. You know, so as I said, there are variations to a disease also. Sometimes it affects very young, it's very severe, and it affects people very young. And sometimes, though it's there, his HLA-B27 means he's always a suspect for this kind of a condition. But if he has not developed ankylosing spondylitis, then in the HLA-B27 spectrum, ankylosing spondylitis is one of the main players, but not the only player. So you can be HLA-B27 positive, but it does not necessarily mean that you will be having ankylosing spondylitis. If he's perfectly normal, then it's fine. And if he doesn't have any eye problems, that's also fine, isn't it? That's good. But he remains a suspect where a checkup should regularly be done. That's all I said. Suspect wo hota hai na ki I suspect you of, taking my stuff. So then I keep an eye upon you. So that is all that it means. Whenever you talk about glaucoma suspect, you talk about myopia suspect. Suspect means that I suspect that because of this particular predisposing factor, you're more likely to have a particular disease. So let us keep a check on it so that the moment it occurs, being aware, knowledge is power. Being aware means that you're keeping a check on things. And if you're keeping a check on things, you're able to catch it early. So that is how it is. The world cannot exist without disease, right? So that's how it is, So all of us have issues. It's just that if you catch it in time and you're able to do something about it, then maybe you suffer lesser morbidities or you're able to delay morbidities. Now here I'd like to put in a word about, say, for example, diabetes. Okay. Now you have diabetes, you have diabetic retinopathy, diabetic nephropathy, which in the end make you blind. And nephropathy is a killing disease, but it kills very gradually. But you see, both of these are end artery disease, which means that both in the eye and in the kidneys, you have end arteries, So if they get destroyed for some reason, you don't have collaterals. Like, that particular organ also starts dying out. But for diabetic retinopathy and diabetic nephropathy to develop, you need uncorrected hyperglycemia or high sugar levels for a very long time. So often, for example, if at the age of 40, you discover that you're a diabetic and you keep good control, then you will not develop these changes till about 25 to 30 years, till when you are 70. Okay, but if you're not keeping good control, you will develop it in 10 years. So there is a difference in your functionality when you're 50 and when you're 70. So the basic control is not correction of diabetic retinopathy or nephropathy. It is basically control of the diabetes, you see. So that is how it is. That is how, the basic management, takes place. Now, if suppose as an ophthalmologist, a diabetic retinopathy patient comes to me with severe diabetic retinopathy, it just means if you go back onto his records and say at the age of 45, if you go back on records, you'll see that good control has not been kept because the person thought he was normal. So that is how it is. When you suspect something, when you know something is there, then keep a watch on it. The more you keep a watch on it, the more you would be able to do something about it, right? Okay, early.
Okay, ma'am.
Thank you, Ankita. So one of our eminent member also from Kolkata, she's Mahashweta Chakrabarti, and she has asked, that's what you're saying actually. Her right eye's retina was detached 10 years back, and how to keep her left eye safe from that.
No, the point is, if your right eye was detached 10 years back, are you a myope? Is she a myope?
Maybe Mahashweta, you can unmute.
Yes. Yes, I am. Yes, I am.
What is the extent of your myopia?
Yeah, I am having minus 10.5 in the left eye, and after operation, I am having the power minus 5.2 in the right eye.
No, that is true. But initially, operation meaning that you are now operated for cataract also, isn't it? That's what
Obviously,
retinal
after
detachment.
retina, after
But then
retina
before that, what
it,
was your power?
it was 14 point something,
So
14.2
so
or something.
basically what it means is that, as I already explained, that high myopia is the risk factor, right? And because it causes extensive thinning of the retina, it obviously causes tearing, and therefore you're always predisposed to a retinal detachment. Okay, so if you've already had a retinal detachment in one eye, it means that the chances that you may have a retinal detachment on the other in the presence of the same predisposing factor is always high, higher than that is there in the normal population. The way you can keep yourself safe is to always have a 6-monthly checkup with your retina specialist, and also the fact that you should always be aware of those symptoms. Like they always ask you flashes of light, or if you see those twinkling stars or something or whatever, as the retina specialist would tell you. But mainly that you should keep on having a regular checkup. You are definitely a high suspect for a retinal detachment. Okay, so you should always be wary of it and keep on checking yourself up before things go. That's all.
Thank you very much. I'm doing that, but I'm seeing some black spots and like cobwebs in front.
So those are floaters. So if you're seeing it recently, you should definitely go and have a checkup immediately. That is what are the warning signs. Okay, you're always told. See, floaters, all of us have floaters as we grow older. Okay, and myopes are specifically predisposed to that for the simple reason that the vitreous becomes, what are these cobwebs? They're basically cells within the vitreous. It's normally semi-solid, that is jam-like, but then it becomes fluid, so it moves. So these floaters move, and you're able to extrapolate it into space, and that's why you see it move like that. So which is fine. There's nothing abnormal about that. But in the specific milieu of myopia, and when you've had retinal detachment, even when you have the retina detaches, what happens is there is a release of a lot of pigments. Because the posterior part of the retina, as we know, the pigment epithelium, is basically, there's a release of pigments. And when those pigments come through, you see more of it. So that's the reason why sudden flashes of light or sudden increase in the number of these floaters, these are warning signs where you should immediately consult your physician. Otherwise, a routine 6-monthly checkup, especially because normally it's 1 yearly, but in your case, since you've had a retinal detachment in one eye, that makes it a high risk. You are already a myope, both eyes, so you are definitely a high suspect for a retinal detachment. So you should definitely be checking up with your ophthalmologist every 6 months, or if you have symptoms, whichever is earlier. So suppose you suddenly, you just went and had a checkup last week, but suddenly today you see these cobwebs and these things, floaters, which have suddenly increased more than normal. Okay, so then you should go immediately. You should not say that, I'll go 6 months later. If you had a problem, so whichever comes earlier, you should do that.
Yeah, see, I am using Cysteine Ultra Eye Drop. Is it okay? And refresh tears.
It's for dry eye. It's for severe dry eye. So why are you using it? Is somebody prescribed it for you?
Yeah. My doctor prescribed it.
If he's prescribed it for you, he must have seen you and then prescribed it. So I will not be able to comment upon that. But it's used for dry eye. So why your doctor specifically said that would be best known to your doctor, because he's examined you, which I haven't. So I will not make a late comment.
I understand. One more thing, he asked me not to put normal water inside the eye. Is it okay?
So once again, this is something when he's examined and he's given you certain, direction, right? So I cannot comment on this in a way. I cannot say this is what you should do or what you shouldn't do, because I haven't examined you. I can just give you general guidelines.
Okay, thank you. Thank you very much.
Dr. Zia, one doctor, he told me, whenever you just wash your mouth or face, just close your eyes and then wash your face. Never like the Mahasheta said, never put water. People used to do the water inside the eyes, they are cleaning eyes. Never do that. It will some harm your eyes or tissues and this.
Yeah, Rita Di, I was told like that. Very true.
The point is that post-surgically, we definitely say that a person should not do this, because obviously if there are sutures, whatever, they may actually, because obviously when you're putting in anything into your eye with a lot of violence, like you take in water and you splash it inside, that is a little bit of violence. So that might traumatize an eye. Otherwise, keeping your eyes clean more gently is all right. Take some cotton and keep it clean, like I mentioned earlier. But yeah, that is the norm, especially it's very hot or something, you go in and then you splash your, that's okay. I mean, if everything is normal, I guess you could get away with it. But if things are not, then probably not, is what I would say judiciously. Post-surgically, definitely not. Because it can definitely, cause, disruption of the sutures and things like that. So no, post-surgery, no. That's one precaution you should take. Post-surgery, no. But otherwise, if the eye is intact and if you've never undergone surgery and you really feel like it, maybe once in a while, yes.
Thank you.
And Madam Meeta G. Basuroy wanted to ask some question. Can you ask? Unmute yourself. Madam Basuroy?
She has logged out probably.
Oh.
And carrying on the question.
Yeah, but carrying on with that floater thing, like sometimes we see that suddenly you see some kind of flashes of light started to come up.
If you see flashes of light and floaters, you should show your ophthalmologist.
Yeah,
Absolutely.
like for example, in my case, I started seeing some flashes like around the corner of the retina. It just comes and goes. I did show ophthalmologist and exactly what
it's normal, then it's okay.
I mean, he could not find anything, but what could be the reason of sudden kind of flashes coming if there is
that's
nothing?
Okay. That is because see the retina is getting see what happens is that normally if it is a normal eye, then you have the vitreous which is opposed against the retina, okay, and it is like a jam. It's semi-solid, but it's almost solid light. So even if the eye moves, it is basically not moving, right? But if it liquefies, then all these problems occur. What happens is because it liquefies, so it moves, with eye movements, right? And then it kind of, hits against the photosensitive part of the retina, producing the sensation of light. So that's why you have flashes of light, right? And because there are particles within the vitreous, so normally you can see these cobwebs because you are extrapolating. It's called entoptic imagery. That is, if something is clear, if the media is clear and there are cells within, then we are able to actually put it out into the environment and see them. So this is a normal phenomena normally, but in the milieu of a retinal detachment, as to why you should suspect it is because if this vitreous is fluid and there is a small little tear, okay, then this movement itself is going to pull that tear. Okay, and so it might increase the detachment, increase the tear and may cause a detachment. That's why definitely if you have it, you should go and check up as to whether there is a tear or not. If you don't have it, it's okay. Then forget about it, but keep yourself on the high suspect list. At the same time, as I already mentioned, that if you have sudden increase in floaters, that just means maybe, there is the detachment, the tear has increased and there is a certain, extrusion of those pigments into the vitreous cavity. So there's a sudden increase, then more than what you had. So yes, that is why I said it's customized. If you really have a problem, yes, which is different from, for example, as somebody asked, that if you're tingling sensation for 3 days, there's an acute problem, definitely you should go in and show. But if otherwise you're fine with the fact that, okay, these many floaters, I know these are there's no sudden increase and I've checked myself, then yeah, you continue on with your 6 month to 1 year schedule of showing a checkup, but definitely don't forget to show it. That is important. Yeah.
Yeah.
Like it is not as if you're feeling normal, so you don't show for 5 years. No.
Yeah. Yeah. Here we have some children with, so Preeti, do you have any question? I always see her with big spectacles.
Ma'am, but I had question on how the timing, what we will do after online class, but ma'am said in the conversation, so there was no question.
Okay.
She's answered. Okay.
Okay. And Shoma also suffers from a lot of problem with eyes. So Shoma, you have any questions, specific questions for Dr. Chaudhuri?
Actually, how rheumatoid arthritis is going to affect the glaucoma patient?
See, rheumatoid arthritis will cause uveitis. Uveitis, you will use steroids. Steroids can cause glaucoma. That's a direct correlation. Okay, so do you have it? Because if you have rheumatoid arthritis, then you will obviously be having uveitis. Okay, directly there is no correlation between rheumatoid arthritis and glaucoma, but it could be because of the use of steroids, which is obviously what you will be using in rheumatoid arthritis to suppress the inflammation, because that is the symptomatic management. And that if used indiscriminately or if used for a very long time just to control the disease. It's like walking a very thin line. What is used to control one, basically the side effect. Now there's a difference, as I would like to emphasize here, between what is called a side effect or an adverse effect. Okay, a side effect is an intrinsic part of the whole thing, right? Of the medication. You may a particular medication, a particular drug has an effect. Okay, you may want one effect which you think is beneficial, so you say that's effect, and the other effect you may not want, which is not beneficial, so you say that's a side effect. Okay, but that is a part of the drug. It is a part of, so when you use steroids, obviously you have a lot more other problems which come along with it. Like you may have osteoporosis, you may have peptic ulcers. So obviously you give medications alongside, you give calcium, or you will give, ranitidine or something, so that the person is looked upon. Now, adverse effect is different. It actually means that the drug has reacted in a different manner from what its nature is. Okay, either it is idiosyncratic or it's dose related. Okay, whatever it is. This is just basically because I wanted to kind of clarify a certain concept, because people use these terms almost, synonymously. You say side effect and adverse effect. Side effect is, so when I say the side effect of steroids is that you need steroids to decrease the inflammation in rheumatoid arthritis, but then steroids have certain effects on the eye. Like if you use systemic steroids for more than 6 months, say beyond, say 30 milligrams per day, then you can develop a cataract, which is called steroid-induced cataract, right? If you're using topical steroids, as you might be having eye inflammation for a very long time, it can cause glaucoma. That is why I say that you should, if you have any of these chronic disorders, you should always be under your treating physician. Because then that person can ask ki kab kam karna hai, kab jada karna hai, you can help certain things, you can only modulate it so that you remain reasonably, functional.
Okay, is there a particular food habit or yoga, something like that?
I know nothing about yoga. Sorry about that. Okay, I know nothing about any alternative modes. It's up to you. That's what I said, that it's up to you, right? Because obviously, keeping a good, healthy lifestyle, as they say, is always good, right? But I will specifically not be able to comment upon any of these as because I'm just not educated enough about it. Very clear on that.
Okay, thank you so much.
Thank you, Shoma. And actually from the childhood also, like when we go to the doctor, particularly the eye doctor, they always say that eat food rich in vitamin A and choto
The point is that none of us are nutritionally, I'll be very specific on this.
That's what I wanted to ask, like, is there any specific food habit that needs to be maintained for the eye health?
That's what I wanted to say, that none of us are nutritionally deprived. If you're nutritionally deprived, yes, you should go in for what actually you require, because none of us, you do not require a lot of vitamin A. Vitamin A is now given along with the immunization schedule. Vitamin A is basically a particular, how should I put it? It is not water soluble. So if you give more of vitamin A, then you can actually have hypervitaminosis A. That's another kind of a condition. It's only B and C which are relatively okay, and that to C. C is on the whole okay. Even with B, you got to be careful. Okay. So as I said, no medication should be given indiscriminately. Okay. And if you take a reasonable amount of what is called standard good food, some amount of carbohydrates, some amount of fat and protein, you're fine. Okay. As I say, that life should be kept simple. There is nothing that you would have. Because
so nothing to be very focusing on for the eye health.
Exactly. So if you've broken your hand and you put a plaster in your feet, it's not going to be very helpful. That's what that's the example which I give. So if people are not nutritionally deprived, you can eat whatever you're eating, so long as it's balanced. There are criteria to balanced food. If you're eating that, you're not nutritionally deprived, then there is no particular reason as to why having something more is going to help your eyes more. It's going to be the same, because your eyes are functioning normally. You can't be more normal than normal. It's quite clear on that. So those are things which are told also, because you see, patients also have a habit of asking that what should I do? Because the reason for that is everybody wants to do something at their own level, that, okay, can I do this? Can I do something so that this does not occur? Can I have this so that my myopia does not occur? Myopia is a structural disease. Okay, the eyeball size is increasing. You can't stop it by having vitamin A. Right? And nor can your retinal functions improve by having vitamin A. That's why there are a lot of placebo drugs in the market. They'll tell you, ye hone se, ye le lo, and your retinal functions will increase, especially when you go old and you have ARMD, that is age-related macular degeneration. It's a normal degenerative process, just as your skin wrinkles out, even your eyes wrinkle out, and even the retina wrinkles out. These are all a part of the gradual entropy to which the body goes through. There is just that place where you can maintain, functionality. So long as you can maintain functionality, it's fine. If there's a specific spot where there is deprivation, look for filling up that spot. But generalized medications do not really help, because there's no proven science in that. So, but then because people like to have something, so most physicians like to give something. That's all. If you kind of say that, yes, I really want to, can I have this? Then most people, especially, you see, I am in a protected position, you know, I mean, I can speak the truth most of the time because first of all, I am not related. I mean, I do not have to take fees from my patient, number one. Number two is the fact that being where I am, people come to me for the truth. So I'm happy to speak the truth, you know, so that is how it is, you know. So, but most people are not. Most of my colleagues cannot. If a patient comes through and say, if they come to me with a, suppose I had a lady like this, you know, she had gone to 5 people. No, I do not see a lot of general patients now, but okay, this was somebody I happened to know, mother of one of my friends, and she had gone to 5 places. She had severe dry eye, and you know, each place where she had gone, they had, you know, given her one more expensive brand and whatever. She came to me, I just told her, "Kya auntie, band kar do, just stop all medications." She stopped it, and she was fine in a month because all those medications were causing her. But I can afford to say that, right? But if you're sitting in practice and a patient comes to you and is asking for a solution, and you tell them that I have no solution, that patient will not come to you, because the person next door is going to say, I have wonderful solutions, and everybody is looking for a miraculous this thing. That's why I always say that don't look for miracles, you know, it doesn't happen. You know, this is all based on science, but people ask for it. Ki mera kaise hoga? How will I live forever? How will I not grow old? So then somebody is going to give you some ointment. It may or may not work out, right? They're going to say this works out, that works out. No. Everybody is going to grow old. So that's how it is. So the eyes are also going to grow old. So giving something that stimulates or does away with antioxidants, all the stuff are not going to do away with things. They have no scientific basis, but people take it and they are prescribed. So I have nothing to comment upon that. It's just that I do not give it. That's all.
The children will be very happy. They have said that you don't have to stop watching TV for a long time, and you don't have to eat specific things. As parents, actually, it is becoming difficult.
I'm told often, but told by parents when they come to me that no, aap inko batana ki wo na ye na dekhe. And I say that I'm not going to lie to them. वो आपका काम है, मेरा काम नहीं है ना कि आप उनको
become very happy.
वो मेरा काम नहीं है, हाँ, because you know I'm very clear about that.
So they have become really happy today. They are really happy. Some of them actually told me that yes, ma'am said that we don't have to really stop reducing the screen time. So that
because how can you help it? Everything is different now. We और भी ज़्यादा screen time increase होगा, आप कैसे कम कर सकते हो? See, it's the content. Just like bad books were bad. Similarly, bad screen, it's the media. See, whether it's paper or whether it's a screen, it's the media. You know, so if this media is replacing paper, you can't do much about it. It's the content that you have to be careful about. Just like you would not read, you know, books which were not quite considered to be kind of proper. Similarly, you should not be looking at digital media. So that is where the control comes. You can't stop the media.
Of course.
Or would you do that?
We have one more question from Mahashweta ma'am on the. She asked like whether contact lenses are better than glasses for myopic patients.
It depends, you know. It depends. I use contact lenses. I'm a myope myself. So that's how it is. So I've used it since I was a kid. So that's how it is. I use contact lenses. I would very much speak in favor of contact lenses because it does give me, you know, a lot of functionality, and along with that,
yeah, ma'am. I am also using contact lenses at the time of my college, so I'm very comfortable with them. But some people told me that as you were using those things, lenses, you are having all those eye problems.
What kind of eye problems do you have?
Like sometimes it's paining, you know.
No, it depends. You see, for example, I use daily wear soft contact lenses. I throw them away that very evening, you know, so that kind of a thing. So it depends, you know, because over a long period of time, if you're using lenses, they have their own set of problems because obviously it's a kind of a foreign body sitting on your eye. So if you're if you specifically have problems with one brand, then you can change a brand, okay? Or you can use you know, stuff like, you know, as I said, if you keep something, then you have to clean it. It has to be cleaned up properly. Otherwise, you know, like, for example, for the past almost 14 years, I use daily wear, which just means that, you know, right now in the evening, I'll just be, before I go off to sleep, I'll just be throwing it off. I used it in the morning, and whatever I do in the later in the night will be with my glasses, you know, that kind of a thing. So that's how it is. It's quite simple. I mean, it depends. If you have a problem, that particular problem has to be dealt with. Okay, generalizations do not work out. Like, I'm comfortable with contact lenses. I would personally never go in for any kind of refractive surgery, which is, of course, you know, but that doesn't mean that refractive surgery is bad, you know. So that's why, you know, if somebody asks me, can I get this done, I send it to a colleague who is doing this, right? But I wouldn't do it for myself. That's different. So if you ask me that, would you do it for yourself? I would say, no, I wouldn't do it for myself. But that does not necessarily mean that if I wouldn't do something for myself, it is incorrect. right? So that's how it is. It is what you want to do and who is the best person to tell you about it, so that is where you should be referring the person. Yeah. So if you're wearing contact lenses and you're fine with it, it's good. If you're uncomfortable with it, then look for what is causing the discomfort and then try and treat that part.
Yeah, I'm comfortable with it.
Then use it. It's as simple as that.
Thank you very much.
Thank you, Masha. What is your suggestion on this dry eyes?
Dry eye is ubiquitous nowadays because the moment, as I already told you, when you look at a lot of screen, you do a lot of screen work, you blink less. So the eye lubrication gets affected. So it is everybody has dry eye now. You sit in an AC environment, for example, in Delhi, for example, in summer, everybody sits in an AC environment. So, ACs always have dehumidifiers. So the moment you go out into the outside, then everything is, kind of all the fluid in your eye is taken out. So dry eye is there everywhere. You sit in an AC car, if it's very humid, for example, in West Bengal, then again, you would sit in inside your house or inside your vehicle, probably, you'd be using a dehumidifier. So the moment you go into a more humid environment, even by there's a natural chemical and physical laws, the environment is going to take out fluid from your eyes. It's going to get dry. So this is very common, right? So that's the reason why, one drug which people always say whenever somebody asks, irritation ho raha hai, they'll say, ha, ye lubricant le lo. So they are drugs which are used ubiquitously all over the world now. However, I would say that if there is a long-term, you want to use a drug for a very long time, then it should ideally be a drug which is preservative-free. If you want to use a lubricant for a very long time, it should be preservative-free, and they are more expensive, right? And the cheaper ones are not preservative-free, so you should actually not be using them long-term. You should actually be trying out practices where you can reduce this kind of a problem where the severity of a dry eye increases. But mild to moderate dry eye is something which everybody has nowadays. Yes, you can't help it. Everybody has it.
Thank you. Thank you, ma'am. If anyone else have questions, we are close to 2 hours now.
Yeah, that's what I saw.
Dr. Chaudhuri has been, no, we didn't start too late, but you have been kind enough to answer.
We're close to 2 hours.
And it was an interactive session. It was a very nice interactive session.
So that's why I thought we'll keep it like that, because you see, once you start, and if I'm speaking a lot, it doesn't much help really, because then you're speaking a lot about the eye and everything. And I think here it's a nice general, you have queries, and it's how I answer those queries, that is what,
right, exactly.
Rather than the fact that I teach you about the eye or whatever.
Okay, thank you, Sam. Thanks, doctor. And I would now request Rita ma'am to give vote of thanks if anyone else doesn't have any question to ask. I think we should conclude because Dr. Chaudhuri is a busy doctor.
I'm not, but as I said, I kept the evening free. That's why I told you. That's why I say Friday ko normally mera free day hota hai, collectively.
That's good to know, because then we can approach you again.
No, that is fine. That will be okay. That will be good. Now, Friday is usually my free day, though, Saturday is very heavy because tomorrow.
Actually, tomorrow is Saraswati Puja here, so that's the reason.
Yes, I know.
Why
students ne diya tha ek card. Haan.
That's the reason why the children are very much enthusiastic about the Saraswati Puja all the time, and the school are opening now, so they are more enthusiastic about it.
No, but and they're not supposed to study on Saraswati Puja. ऐसा कुछ होता है ना, उस दिन पढ़ते नहीं.
Yes, and it starts from today.
So that's the reason why they're probably not here also.
Pre-Saraswati Puja.
That's what I'm
yes.
saying. So they'll be, and it's a weekend then, Saturday.
And
Sunday,
it's a Friday night, so normally students are given.
Friday is usually my light day. Saturday is actually very heavy.
Children are given like the light day that, okay, you have studied the whole week today, and let's take a break.
You can kind of play.
Like
yeah.
So I'd request Rita ma'am, Dr. Rita Bhattacharya, to conclude the session with concluding remarks and vote of thanks.
It's really amazing. And thank you so much, because 2 days back and at night, not even midnight, 1:10 or like that, after 1 a.m., I just requested her, can I request something? And then she said, we are chatting. She said, okay, yes. And then when I said, without hesitations, she said yes. That is why really, Dr. Zia, I'm so happy the gesture you showed, and it's really amazing, admirable. And you spent nearly 2 hours. It is also really nothing. I don't
I
have
enjoyed
any
myself.
good
I'm serious about it. I enjoyed myself. It's okay. I mean, it was free. I enjoyed talking to you. It's okay. I mean, I keep things simple, I mean, really, I mean, I'll tell you this, that I can't, I've never been able to keep airs and graces about myself. That is how it is. I enjoyed myself. So I'm happy about it. I enjoyed myself equally. I didn't do anybody a favor.
And another thing which I like most, you never said, don't do this, don't see the much thing, do the exercise.
No, because these are not
have the
required. There is no
medicine.
scientific basis for all of this. Most people would tell you that just because, people, no, the problem here, ma'am, is that people ask for them. Often people like to hear, like a patient of mine, जैसे squint operate करके मुझे पूछेगा मैं क्या खाना खाऊं, मैं बोलूं कुछ भी खाना खाऊं ना, क्या फर्क पड़ता है? It doesn't make a difference. Only thing is we should not do that कि पानी के झपके से पानी नहीं देना है. That is one thing which post-op we say कि वो sutures खुल सकते हैं. So you should not do that. And to ऐसे कि दो महीने तक मत करना, उसके बाद कर सकते हो when it heals up properly. So that's how it is. You see, people have to live normally as much as possible without feeling that they're diseased. That is very important. That is more important than 10 other things. Otherwise, I know people jo ye bolenge morning mein that we must have this 1 cup of honey, 1 chammach of honey, and all these don't make any kind of difference if you're not happy. At the end of the day, that is what you have to be, normal and happy. And so that is why, so as much as possible, one should enjoy life. If you enjoy life, you'll be healthy. I mean, that is the way I work it out. That is what I tell people. And it works out well for them. But there are many people who like to worry and like to keep tabs. Now, if you want to really keep tabs, then I won't stop you either. If you say that, should I do this? And I'll say, okay, fine, it's up to you. So that's how it is. But if I technically say something as a physician and say that don't do it, then what happens is you are going to kind of take it very seriously, So when there is no scientific basis for it, then why should I say that? That is all.
and somebody is telling have carrot every day. So your eyes will be very good. For your this eye health, you have to have carrot. You have to have vitamin A. You have to do some exercise. So many things. But after
enjoy yourself.
You, it's really, really, we are very happy to know that these are nothing to only to what to say, to make our happy or make our fearful.
Yes, that's what I said. This make no difference. There's no scientific basis to doing this. In fact, if you start taking vitamin A capsules every day, you'll probably endanger your liver. So don't do that ever. Yeah, because people do that. वो बोलेंगे vitamin A का ये वाला capsule मिला, ये cod liver वो मिला, ये मिला. Don't do all those things. They're not required. And if you're deprived, yes. If you're deprived, then vitamin A will present as white spots, severe dry eye, corneal. There are signs and symptoms to it. Okay, if you have vitamin A deficiency. Okay, so it's not something, and you'll be otherwise also deficient. You'll have dry skin. You'll have other problems. So if you're normal, you're eating normally, then vitamins and minerals are usually looked after. Buy your normal food. If you're taking a normal balanced diet, it's looked after. These are micronutrients. You don't require a lot of it.
That's true. That's true.
So you don't require addendums to it unless you have a deficiency.
That's true. And for here also, people are telling take vitamin A and E for your hair.
That's what I say, that any of the fat soluble vitamins be taken with a lot of care and definitely under supervision, because they can cause problems.
That's
if
true.
you take it just like that. Like vitamin K is probably prescribed for skin and everything. As I said, that if you normally keep yourself healthy, I mean, your skin is also fine. But then people nowadays want, because it's available, they'll want almond shaped eyes and they'll want a nose like that. I think the way God made you is perfectly fine. So it depends on a philosophy. At the end of it, if you really want to go and say, I want my ears like this and I want my eyes like this, and nobody can stop you, and a lot of plastic surgeons would be very happy to do that, give you cosmetic this thing. But you see, at the end of the day, everybody is going in the same direction. I mean, if you look at it that way, it's okay. And nobody is going back in time, So yeah.
It's really very, very nice and so simple way you said and what you said, that these are really, really give us not only solace, make us happy too, to know that all this bullshit, I shouldn't say like that.
No, you're
But
absolutely right. I agree with you that, it's just like, when people would say कि आपको इस दिन को उठ के fast करना है. Fasting is okay. Maybe if you're overweight and you say that, अच्छा ठीक है, मैंने fast कर लिया तो थोड़ा वो हो गया. That's okay. That's scientific enough. But to say इस दिन नहीं किया तो ये हो जाएगा. No, all those are fads, Those are basically meant to discipline you so that you follow a trend, but they do not have any basis per se, as far as science goes.
That's true. Making us fear, making us weak, isn't it?
Yes. But basically it's meant for disciplining. That's so that you become a part of a herd, but whatever, that depends. As many people like it also. So I wouldn't stop them from doing that if they wanted to. But yeah, I mean, what I'm trying to say is that professionally, I would say that there is no scientific basis. This is not just my opinion. It's my professional opinion that, and based on science, that there is no scientific basis to these things. So it is up to you. I mean, and sometimes if you do it, it might actually be harmful also.
That's true. Somebody asked, Ankita Kaur asked, where do you live, Jia ma'am? Jia ma'am is living in Delhi. When I introduced her, I told everything, where she is working, where she is living, everything. She is in Delhi. So
Okay.
her everything, her work, place, her house, everything is Delhi. She's coming to Kolkata, but she is stationed at Delhi.
No, but I was born in Calcutta. Actually, that is one thing. I was actually born in Calcutta, but my father shifted to Delhi in 1975. And since then, I've been in Delhi. I mean, I'll be 50 this March. So I was born in 72. I was born in Calcutta. So but then from 3 years of age, so my complete education at each level has been in Delhi. That includes my, more or less. My fellowship education, yes, I've been abroad also, but then my essential MBBS, MS, my PhD, everything is from Delhi. My work, I never really had to shift out of Delhi.
That's good. That's good. You are very lucky that you are not going here and there, and you stationed in one place, and you were very much focused, and you are doing so well within this 50 years. And you have published more than 150 papers. So, and you are associated with so many things. We are really happy to have you in Kolkata, Nivedita Shakti. Please bless our children and be with us. This is our request to you. Be with us.
I've enjoyed myself.
And really, really, the very, very enjoyable and very nice program we are having. It's really memorable because of you and because of your talk. I thought how it will be possible. Only we will discuss. The children will ask you. You said, look, it will be very nice. Really.
No, because you see, I actually keep on doing, there are places where you take lectures. There are places, I knew that with the kind of audience that you were saying, that a didactic lecture is not going to work. That will be very boring.
That is the difference between one expert and one novice.
No, so I knew that if they ask
you expert, so you know how to take the flow and what to do there. So you have very clear vision. So that is why you said, I'll manage, I'll do. So
yeah, I knew that in this circumstance, slides would not really be server purpose. It would not be half as enjoyable because it is not a technical audience. A technical audience, if I'm speaking of something, then it's different. This is an audience which is like, how would I say, little kids asking me general questions. So it has to be questions, it doesn't have to be. Yeah, I mean, I told you that, that is how I would like to do it. That is what I would be fit in the fit the situation best. Yes, I'm glad you agreed with me.
Thank you so much. Thank you.
Rita,
yes.
Rita, may I have a neuro-ophthalmology question to madam?
Yes, definitely, yes. And Suchitra Majumdar, Dr. Suchitra Majumdar is also one ophthalmologist. She was professor in PG Hospital, SSKM Hospital. Now she retired. She is a very, very good friend of mine. Not only that, she is our one potential member also in Kolkata Nivedita Shakti. Yes, sure, Suchitra.
Madam, one of my close relatives, he stays in Delhi. He was suddenly having right-sided loss of vision. So on MRI, that the findings are suggestive of chronic infarct involving the left occipital lobe.
Okay.
What is his prognosis? He was just calling me.
So what is his age? What is his age?
Age is nearing 70.
So that is what, if he has, so that means basically it's a kind of a stroke. It's a kind of a stroke reaction where basically, you know, if the occipital lobe goes, then he has right-sided, you said left-sided occipital lobe and right-sided vision?
Yes, he's having a problem with driving. That is his main
So that
concern.
is what you see. The point is, as I said, in fact, my current postgraduate student basically worked on a stroke because her work was in functional vision, because I do pick up topics which are unusual for I get MD students from the University of Delhi who train under me. So the current topic, in fact, was stroke, because we deal with our stroke colleagues. So this is a kind of a stroke where, you know, one side is gone. Okay. It's finally, as I told you, it's the brain which does everything. The eyes are just the shutter. All this collation is taking place in the brain. So if the brain is hurt, then there is very little that the eye can do. And there is very little anyone can do, right? Yes. So if your left side has been affected, left occipital lobe is affected, and your right side is, you know, kind of not doing very well, then I would actually say that at this point of time, and if he's facing problems with driving, I would say at this point of time that he should probably not drive, both for his own safety and the safety of others, because it just means that one side of the you know, visual field is probably not going to be there. Now, if this person wants to consult me, then I shall be available at RML Hospital or at Lady Harding, wherever. But in his case, I would make it as RML Hospital because it's an adult. Like I sit in Kalavati Sharan Children's Hospital, you know, which is one of the largest pediatric ophthalmology setups, pediatric setups in northern India. It gets all kinds of referrals. So it's based on the concepts, probably one of its own kind. Like it's a pediatric hospital where you have ophthalmology and other specialties also. So that's why we get to see a lot of systemic things, like, you know, like all kinds, you know, for example, like see a lot of RA patients coming to you, a lot of, you know, children having, say, maybe HIV, or a lot of children, for example, with autism and all that. And it's a big referral center. In an eye setup, for example, only those children would come who actually have an eye problem. Here, any child who comes to the different clinics in the pediatric setup comes to ophthalmology also. So that's why we have but for an adult, I usually would see them at RML Hospital. So he wants to show me, it's fine. But otherwise, as I said, because if he's positioned in Delhi, he can show me, but not if it's elsewhere. But the point is that if you know, if you have an occipital lobe, it's called you know, cerebral visual impairment. Okay, CVI. So if you have one side which is gone and acquired CVI, means he'll probably be having a visual field loss of the other side. And ideally, under those circumstances, both for his own safety and for the safety of others, he should not drive, because that one side he cannot see. Driving has a lot to do with the fact that I'm looking straight ahead, but I'm aware of movements that's occurring on the sides, you know, which virtue which I'm able to save myself. Yes. Right? You know, something is, but if I'm not able to see, you know, at all, then under those circumstances, you know, you know, suppose a bus comes through and whatever and hits me, or something else comes through and I hit something, you can land up into accidents, you know. So ideally, you should not do that. He can maybe take in a driver or something. On those unfortunate things which happens.
Is there
but yes,
any scope for improvement?
No, if the brain is gone, no. If there is an infarction in a brain, then no. Then no. Yes, you got to accept that this is how it is. But functionality, as I said, is adaptation to the circumstances which exist. So if I know that I cannot see one side of my vision is gone, the other side is there, my foveal vision is there, I can still probably work on my computer, but I may not be able to drive. So it's basically taking care of something which you may not be able to do with that level. No, it's the expectation. If you look for something, if you try and do something which is beyond your capacity to do, after a while, like suppose I'm 80 and I say that I'm going to climb 1,000 steps, I may not be able to do it. You know, my physical capacity may not permit it. So at each point in time, you go along with your physical capacity and what exists. In this case, if the brain is infarcted, definitely the chances that, you know, that part gets to be absolutely normal is not there. Beyond that, I won't be able to comment, because I would like to know that what is the visual field effect that he has. If he has a significant visual field effect, then he should not be driving.
So how to contact you in RML Hospital?
I think Madam has my number. You can ask him to WhatsApp me, or I'm actually on much more onto that. Most of my patients for the past 20 years have my WhatsApp now, have my SMS number. Yeah. So you can contact me and you can figure it out. Though in January I've been seeing less patients because of the wave. I mean, there was a lockdown kind of a thing, but things are opening out now. So I will start seeing them again. Yeah. So you can contact me and you can come. Yeah, with the reference of say Madam or something.
I shall share the number with you.
Yes, thank you.
Thank you so much. We have taken lots of your time. You must be very tired.
Yeah, I'll just go across now.
Okay. So let us close now. Thank you so much from the bottom of my heart. And thank you so much from the Vigyanika Shakti VIPNet Club. So really, we all are blessed, especially our children are blessed to have you. And if needed, if our children want you, definitely they will call you again. You will
I'll be happy
with our children. And whenever you will come to Kolkata, definitely meet our children. They are really angel. Today, their presence is very less, but they are really super.
No.
Just I am going to say that thing, ma'am, please visit our Calcutta also.
I'll do that. I used to be quite regular in I used to regularly go to Calcutta when my grandparents were alive in the 1980s. Okay, but after that, things have been a bit infrequent. The last I went to Calcutta, in fact, was in 2019. I'm a member of this SERB thing. So there was a meeting there. So we had gone there. And for 2 days, but that was official. So I was just able to meet 1 or 2 relatives. But yes, I mean, if I know specifically that I have to kind of meet you, I'll be happy to do that. No problems about that.
And from today, you have a big family. That is the Kolkata Nivedita Shakti family and the Vigyanika Shakti family in Kolkata.
Thank you. Are they different? Vigyanika is Vigyan.
One project.
The Vigyan part, they are in 2 years. It's a part.
It is a project of Kolkata Nivedita Shakti.
Yes.
Okay. Bye-bye.
Okay, bye. Thanks a lot.
Thank you, ma'am.
Thank you so much. Thank you.
And meeting for all.